Dear students, we'll discuss today a rather a operative procedure, something like a reconstruction. Actually, you know that reconstruction ladder is in that from the below upward, suturing, secondary suturing, grafting, free flap like that. So one of these component of this reconstruction ladder is flap. And different flaps are there: axial pattern, random pattern, free flap, rotation flap, so many rhomboid, that everything. All these things are called as a flap because you know that a graft is different where you remove a part and put it somewhere else without any blood supply. Whereas here, always flap is a donor area with its blood supply. It is placed into the recipient area. It's vascularized actually, both artery and vein both. So that is a flap. That is how flap differs from the skin grafting. Skin graft or graft as such, any graft. You discuss a flap which is not uncommon. It is quite commonly done. At least it can be done by any general surgeons, any competent surgeons, without much difficulty. Easier to do, quicker, reliable, and adequate also. Not very technically demanding like free flap and so on. So this is a deltopectoral flap, otherwise called as Bekamjian flap. What is it? It is a fasciocutaneous flap. Many times people get confused that, especially students in MCQ, whether it is cutaneous flap or myocutaneous flap or muscular flap. Many times they feel that deltopectoral means it is the muscle and deltoid muscle and the pectoralis major muscle. It is not so. It is the fasciocutaneous flap harvested from the pectoral and deltoid region. That is why it is called deltopectoral. Here, like this, from the deltoid region, from this. So this deltoid region is the pectoral region. So here, second, third, fourth intercostal vessels are there. They are as a pedicle or blood supply to this flap. So like this, it is harvested in the region. It's a fasciocutaneous flap. It is not muscular flap or it is not myocutaneous flap. That is a point which you have to always remember. It's MCQ question. So it's also called as Bekamjian flap. And already told these intercostal vessels are branches of internal memory artery. And I already again told it is easier to harvest, easier to rotate, takes up well, and good blood supply, adequate length. So all those things are important thing. Only thing is you have to tubularize the intermediate part after suturing the distal part of the flap, and this pedicle, after 6 weeks you have to dismantle and resuture over the recipient area once blood supply is maintained from the recipient bed. So that is a staged procedure again. And donor area, if it lacks skin is there, especially in old people, we can always do a primary suturing. Otherwise, you can place a skin grafting over the donor area. So it is from the mainly second intercostal vessel, which is a branch of internal memory artery, and deltoid and pectoral region is a fasciocutaneous flap. And naturally, it is useful mainly for the facial defect and neck defect because it rotates well. Now, problems are kinking, infection, flap necrosis, thrombosis of the vessel, and flap failure. So if flap fails, then you need to think of some other flap, maybe forehead flap and other things. So these are the different problems which you can face in case of deltopectoral flap. Overall, it is a good flap, easier to do technically. I already told. So already told donor area, and you can rotate this one donor area. You can either suture or put a skin graft. And types of flaps already discussed: random pattern, axial patterns are clear cut. Random patterns like this flap, blood supply comes from the base like this, multiple. Whereas it is just one linear blood supply comes. Flaps, when the flaps are used, it's very important. When a graft fails, when there is a exposed bone without periosteum and cartilage, tendon is exposed, you can't place a skin graft. Graft won't take up. So in such situation, flap is essential. And deeper defect, like in oral cavity, in the deeper planes, you need to have a flap. And so these are different areas we have to use a flap. Advantages are blood supply is maintained, cosmetically better, healing is good, gives a good bulk and mobility. Only thing is the staged procedure, complications, long duration, hospitalization. So repeated anesthesia, infection, failure. So all those things are the real problems with the flap. Flap in general, not just deltopectoral flap. So flaps are a short note. Flaps is a short note for UGs and PGs both. So what are the different types of flaps are there other than rhomboid flap, Z-plasty, free flap, forehead flap, petrolus major mycotinus flap, local rotation flap, Z-plasty. So the different type of flaps can be flaps can be planned and thought of depending on the situation. So just require some physical principles, physics to rotate it, angles, everything, so that flaps will take up, will maintain the blood supply, identify the blood supply Doppler or whatever it is, then rotate it adequately. So mark it properly. That's what is required when you think of a flap in different situations to cover the defect. For further reading, read my SRB's Manual of Surgery Reconstruction chapter. All flaps are given properly with the diagram, photos and illustrations. That is more than sufficient to write a short note or to answer in Viva, because oral malignancy is a short case kept in Oxy, and they will ask what flap, different flaps they will ask, so you should know. And lot of MCQs will be asked in the from this reconstruction chapter, because each flap, forehead flap, what is the blood supply of the forehead flap, what is the blood supply of petrolus major mycotinus flap, what is the blood supply of the deltopectoral flap, what type of flap it is. See, petrolus major mycotinus, it's a mycotinus flap. Deltopectoral is a phagocytinous flap. So like that, different flaps are got different types. So all these things you should be able to remember and recollect and write in the MCQ answers. So go through my Manual of Surgery Reconstruction chapter for every detail. Again, I request students to subscribe my YouTube channel SRB Surgical Insight for daily updated lectures, briefly 5 to 10 minutes, so that you can have a daily surgical knowledge about images, X-rays, instruments, operative procedures, clinical cases, brief discussions, images, everything. And also once in 2 weeks live sessions where we will have a extensive 1.5 hour discussion about the case presentation. And with other than me, many other faculties also will be there, senior faculties from different institutions. So with the interactive sessions, so you can always have certificate, which will be useful for your future career. And also you can chat or put it in the your questions in the chat box, so that you get a proper interactive answers. So it will be very, very useful, especially when you face long cases, Oxy, clinical side, because it is an interactive discussion, in detail discussion for more than 1.5 hours. So always join live session to help yourself for your exam and learning purpose as such. Again, request, join, subscribe my YouTube channel, share with your friends, and press the bell, and learn surgery to my YouTube channel a day-to-day basis. So answer the MCQ. Waltzing is A, B, C, D. Write the put the right answer in the comment box. I will acknowledge your answer. Another MCQ is petrolus major mycotinus flap is based on A, B, C, D. Again, put the right answer. I will acknowledge and appreciate your answer later. And also again, please subscribe my YouTube channel to learn these MCQs also, which is again very, very useful for your NEET exam or competitive exams and your current examinations also. All exams contains a NEET MCQs also. To answer those things, it will be very, very useful. So day-to-day basis is all these MCQs you can learn. And quotation of the day: a meaningful silence is better than a meaningless words. So unnecessary words, unnecessary talking, we should avoid. So what you put the word should be very, very meaningful. So avoid meaningless words. It will not be appreciated. So be aware of what you are speaking. That is very, very important, especially when you are a matured surgeon as such. That is the quotation of the day. Again, a request to join my YouTube channel, students, and also go through my SRB's Manual of Surgery current edition for in detail subject matter with the MCQs online, and everything in Oxy is covered, from general surgery, endocrine, thyroid, breast, parathyroids, GI surgery, everything, liver, gallbladder, GI tract, stomach, hernia, urology, specialties, cardiothoracic, neurosurgery, basics, instruments, specimens, anesthesia, and briefly recent advances with a lot of illustrations, photos, quotations, and treatment strategy, management policy, principles with a lucid, understandable language. With the wherever oxy topics are there, also it is covered for both UGs and PGs. So make use of my SRB's manual of surgery for your better understanding of surgery knowledge as such, and also my SRB's clinical methods in surgery. It covers all clinical examinations, general surgery to hernia, thyroid, breast, varicose vein, vascular diseases, GA examination, abdomen, briefly orthopedic, and with the instruments, specimens, and briefly images as such. Video examination of the each topic, each chapter, which will very useful for your clinical examination, and principles of examination with a lot of photos and brief differential diagnosis in tabular form. But it doesn't contain, because it is a clinical book, it doesn't contain any management policy. For management policy, you have to go through the SRB's manual of surgery. But clinical book, it is very useful. Everything in detail it is there. So please purchase my clinical book and manual of surgery to have a complete understanding of the surgery as such. And my operative surgery current edition with the 2-volume extensive book, about 10,000 photos and illustrations, very useful for upcoming surgeons, surgical surgery PGs, and practicing surgeons. In detail, step by step, all procedures, even GI surgery, general surgeries, endocrine surgeries, everything step by step with a lot of photos and illustrations, with the instruments, energy sources, everything it is covered. It will be very useful for all surgeons who is practicing. Before surgery, they can go through the steps and do the procedure skillfully without much problem. So please go through my SRB's operative surgery atlas and guide atlas, actually text and atlas, current edition 2-volume book, very useful. Definitely you'll understand the technique, small procedure to big major procedures as such. My SRB's tissue approximation, again brief small atlas book, 100 pages, which shows how to approach different suturing techniques, different methods, different types of suturing, different skills of suturing, different suture materials, and skin suturing, deeper tissue suturing, bowel suturing, laparoscope suturing, with the principles, and also with the video of suturing. How to do all suturings are videos are there. That also very useful for all students. So please go through that. My SRB's tissue approximation book also. So students, again I request to subscribe my YouTube channel to have a best surgical update as such, daily, day-to-day basis for your clinical knowledge, image-wise, and also join live sessions once in 2 weeks for extensive knowledge about the clinical discussions for more than 1.5 hours. So again request, please subscribe my YouTube channel, share with your friends and colleagues, and press the bell. So students, I hope you understood this lecture very well. Thank you so much.